Dr. Paul Thomas and
Dr. Raquel Orlick.
And we're at Plum Health, and we're hanging out today, and we're talking about something really important. We're talking about the only cancer that you can prevent, like 100% you can prevent this cancer, and it is?
Cervical cancer.
And a lot of people don't know what a cervix is, and I think if a cervix was as well known as, let's say, breasts or lungs or a kidney, this would be prevented already. There would be no cervical cancer. But we're going to demystify what a cervix is, and we're going to talk about how you can prevent cervical cancer. The cervix is a muscular organ that sits between the vagina and the uterus. It protects the uterus from bacteria. You can also see the cervix at the end of the vagina in the schematic.
It is a muscle, so it expands and it also closes. So it's really important because it's there to protect you from infections coming from your vagina into your uterus. And it's also important when you have a baby that it doesn't open prematurely. That would lead to a premature delivery. So it has many functions. And then when you have a period every month, that's also what opens is the cervix. Now, unfortunately, the cervix is prone to infections. Specifically, the infection that we're concerned about is called HPV, or human papillomavirus.
Yeah, and HPV, or human papillomavirus, is just human wart virus.
Yes.
And there are literally 100 different types of HPV. Like there's HPV-1 or HPV-2, let's say, and that can develop like a finger wart or a toe wart, like a plantar wart that we're all familiar with. There are different forms of HPV, and it just so happens that certain strains affect the cervix, which is this muscle between the vagina and the uterus.
Yes, and those are 16 and 18, a few other high-risk strains, and those are the ones that are responsible. They would say in about more than 90% of cases what causes cervical cancer. Additionally, the virus has been linked with other types of cancers as well. Cancers of other part of the genital region, penile cancers, anal cancers, but also have been associated with head and neck cancers. So not only for the women, it is a concern for men as well.
Yeah, so how can we prevent HPV?
So luckily there is a vaccine. It's initially offered to children, so starting at the age of 9. Part of that reason is that we want to make sure that they're fully protected before there's even any chance of them being exposed to the virus. Traditionally, it was offered from the age of 9 through the age of 26 for both girls and boys, but now it's actually, within the last few months, it has been approved to actually go up through the age of 45 because of the importance of preventing that virus from causing the other cancers that we just mentioned.
Right, so men and women can get the HPV vaccine, also known as like Gardasil.
Yes.
And it usually comes in 2 doses. And basically you're trying to prevent HPV from developing.
Yes, and the other thing that's important to remember is that HPV is considered a sexually transmitted infection. However, you can't just protect it with condoms. So you might say, I'm always taking the precautions, but all it takes is the skin-to-skin contact involved with, sexual intercourse to potentially get the virus.
Yeah, they say like the boxer short region. So if you imagine anywhere where your boxers cover your body, contact between 2 people in those regions can transmit the infection. It's pretty easy to spread this virus, which makes it difficult to prevent HPV and cervical cancer.
Right.
So when should we screen for cervical cancer, and how do we screen for cervical cancer?
So it's very easy. It's really simple. We actually have a couple of sample utensils that we'll show you guys in just more detail in just a second. But the test that we can check for any of the abnormal changes to the cervix is called a pap smear. And essentially it's a procedure where we come here with this small speculum and we visualize the cervix. And what we would do is with a small brush here, we would essentially go in and just take a very small sample of the cervix, and then we would send it off to the lab. I would say it probably takes less than 5 minutes tops.
Yeah, and it's a really easy procedure. I'll just demonstrate on my hand if this is not too awkward, but if you imagine this as the cervix, we use the speculum to look inside the vagina at the cervix, make sure there's no lesions, and the brush just goes right inside the cervix. We make a couple turns to get the cells from the cervix using the brush and the what we call like a spatula, and this just takes the skin off the surface of the cervix, and then we take these two and send them to the lab. And it costs, between about $30 and $60 to run this test, and it takes 5 minutes. It's easy to do. Do you have to be a gynecologist to do this test?
No, you don't. Family doctors do routinely offer it, so it's something that we can offer here at the clinic for you. So if you are between the ages of 21 to 29, you should be getting this test done as long as everything is normal every 3 years. Now, once you hit 30 to age 65, some of those guidelines changed, so you can continue to do the Pap test for 3 years, or you can additionally add on the HPV test, which then, as long as the Pap test and the HPV test is normal, you actually are granted 5 years in intervals for screening.
Yeah, and this is a change from what most women understand. I go in for my annual screening test, and that's just not the case. You don't need to have a Pap smear every year if everything's normal. If everything's normal in your 20s, you can have it every 3 years, and then between age 30 and 65, you can basically have it done every 5 years if everything is normal.
Right.
So a lot of people dread that annual, and you shouldn't. This is something that you can protect yourself from cervical cancer. It's a very preventable thing. We should talk about what the Pap test does not test for.
Right. So it does not test for other sexually transmitted infections. So it does not test for chlamydia, gonorrhea, herpes, HIV, bacterial vaginosis, which is not a sexually transmitted infection. All of those cannot be tested by the Pap smear. We can offer testing additionally for those infections, but the Pap smear does not test for that.
Yeah, so like HIV test is a blood draw, and that's $10. Syphilis test is $4. That's also a blood draw. When we test for chlamydia and gonorrhea, we usually have people urinate into a cup, and that's $23 for that test. HSV, herpes simplex virus, is another blood draw, and that's $17 for HSV1 and HSV2. So these tests are easy to do, but they're not done with a Pap test. Pap test is simply checking the cervix for precancerous tissue.
Yes.
And then if you need to have this Pap test done, how can people get this done?
Well, essentially, if you would like to be a patient with us here at Plum Health, you can make an appointment with us. Myself or Dr. Paul can do the Pap test for you. Like we talked about, it's a very quick procedure, and it can prevent cervical cancer.
Yep, and that's the point of us making this video. We just want people to know that cervical cancer is preventable, and if you need some help getting this done, we can either take care of it in our office or refer you to someone who can help as well. So thanks so much for watching, and have a wonderful day.